Almost Anorexic, a book presentation by Tisha, Courtney, and Kelsey. We will be sharing the honor of presenting the book Almost Anorexic. I, Tisha, will begin with the introduction and synopsis. Then Courtney will share the resources available in the book. Kelsey will conclude with spiritual messages and final critiques. Dr. Jennifer Thomas and Jennifer Schaefer co-authored the book Almost Anorexic. Dr. Thomas is an assistant professor of psychology at Harvard Medical School, where her research focuses on eating disorder diagnostic criteria to better reflect the experiences of real patients. Dr. Thomas has evaluated and treated hundreds of individuals of all ages with anorexia nervosa and other officially recognized eating disorders. Jenny knows what it's like to have an eating disorder and to fully recover from one. Jenny's eating disorder started at 4 years old. When she took dance class, Jenny battled almost anorexia for 20 years. She never realized there was a problem because everyone, including doctors, said that dieting is perfectly acceptable and saw no problems. Almost Anorexic is divided into two major sections. The first focuses on identifying unhealthy patterns and behaviors that may be present in someone battling almost anorexia. And the second portion of the book discusses how to kick one's eating disorder to the curb by providing helpful tools and powerful encouragement. When an individual has an unhealthy relationship with food, exercise, and body dissatisfaction, but does not meet the specific criteria of common eating disorders such as anorexia nervosa or bulimia, he or she may fall into the category that the authors define as almost anorexia. Almost anorexia is a dangerous gray area that actually is far more common than the standard anorexia. 1 in 200 people experience anorexia nervosa, whereas 1 in 20 experience almost anorexia. In regards to almost anorexia, the authors state, "We have seen that people with almost anorexia sometimes feel worse than those who actually have anorexia nervosa, because those with almost anorexia assume that they're not sick enough to deserve help, and so sadly never seek it." One main point that the author emphasizes is that almost anorexia comes in all shapes, sizes, with notable attitudes and behaviors being restrictive eating, dieting, binge eating, compensatory behaviors, and distorted body image. The second section, which focuses on recovery, the authors function from the premise that full recovery is possible and encourage those struggling with eating disorders to never give up. We appreciated the practical treatment strategies and the tools given by the authors, which Courtney will soon discuss in greater detail. One main strategy the authors suggest is naming the voice in their head that encourages unhealthy, almost anorexic attitude and behaviors. The main name used in the book was Ed, but other suggestions, Anna and Rex. Naming the disorder makes it possible to disassociate the eating disorder from the client's own identity in the order to better fight against it. This empowers the client to find their own voice in their recovery. This is one of the main tools given by the authors to help clients, loved ones, and clinicians overcome eating disorders, which Courtney will now discuss in greater detail.
The book Almost Anorexic is a helpful resource for clients. Almost Anorexic determines if your relationship with food is a problem and discovers scientifically proven strategies to change unhealthy eating patterns. Like Tisha mentioned earlier, the book explains an externalizing technique where the client learns to name the negative voice inside their head, which allows them to separate from their eating disorder. Practical self-assessments like the Eating Attitudes Test, also known as EAT 26, are included in the book. EAT 26 is the most widely used eating disorder screening measure today and can tell if one's concern about eating and weight are higher than most people's and if one could benefit from a professional evaluation. The book avoids providing details that individuals struggling with almost anorexia might find triggering. At the end of the book, there's a separate section on seeking professional help. The book lists multiple helpful resources for finding eating disorder specialists in one's area with websites, helplines, support, and therapy groups, and resources to help pay for treatment. Almost Anorexic would be a valuable resource for family and friends of someone struggling with an eating disorder because it would help them gain insight on how to intervene with a loved one. Jenny Schaefer's story is highlighted throughout the book, and she experienced subclinical, almost anorexic symptoms first before developing a full-blown eating disorder. Relationships and social support play a vital role in your loved one reaching full recovery. Treatment can look different from each individual struggling with an eating disorder. Depending on the treatment approach, day treatment, residential care, inpatient hospitalization, or outpatient treatment, you might need different types of professionals to help you and your loved one. Many people call this group of professionals a treatment team, and this can include a therapist, psychiatrist, primary care physician, dietitian, or other medical specialists, or any combination. At the end of the book, there's a section for ideas on how to assemble a treatment team, finding a group, paying for care, how to identify a therapist who specializes in eating disorders. And this book would be a beneficial resource for clinicians treating clients struggling with eating disorders. Current research and clinical expertise presented in the book can open opportunities for clinicians to intervene more effectively for clients with eating disorders. Recognizing the almost effect in eating disorder patients has two primary goals. One is to alleviate pain and suffering now, and two is to prevent additional problems later in life. Part 1 of the book describes almost anorexia in greater detail, including symptoms of the disorders, and Part 2 of the book offers solutions based on empirical research and Dr. Thomas's clinical practice. The book also provides a list of the DSM-5 criteria for almost anorexia, subtypes of other specified feeding and eating disorders, bulimia nervosa, and binge eating disorder.
Though the book is not overtly spiritual, the authors do encourage readers to explore spirituality during their journey in recovery. Additionally, the overarching message they present is one of redemption. Dr. Thomas and Jenny consistently emphasize that full recovery is possible. This resonates with the main theological tenet of the gospel, which is healing and fullness of life for those who are saved by Jesus Christ. It also aligns with numerous scriptures such as Exodus 23:25 that refer to God taking away sickness from his people. Dr. Thomas and Jenny also have an undercurrent of grace throughout their book, encouraging readers to get back up again anytime they may fall and to never stop pursuing the next right thing, much like believers are encouraged to do in Galatians chapter 6. The themes of almost anorexic closely align with major themes of Christianity, and a reader could easily incorporate the principles from this book with their faith journey as they face almost anorexia. Overall, our critique of the book is that it's helpful in the way it addresses and validates a rather ambiguous arena of eating disorders, but one which encompasses ultimately the majority of eating disorder cases. The way the authors address unhealthy attitudes and behavior is infused with grace, understanding, and empowerment that can encourage a reader to seek the help that they need and believe that, number one, they are worth recovery, and number two, that they have the power to achieve it. They also include real-life examples of different clients that Dr. Thomas has worked with, including men, women, people of color, and LGBTQ individuals, which we see as a major benefit. They also include excerpts of Jenny Schaefer's own journey of cutting ties with Ed. One downside to this benefit, though, is that there were a few of the stories that were not concluded. The author would share a story, but not give a final conclusion of how the client had recovered. An additional critique can be found in the term almost anorexic. The authors drive the point that often when individuals fail to receive the diagnosis of anorexia nervosa or bulimia nervosa, they feel as though they have failed. The term almost anorexia implies the same idea, that a person almost has anorexia but not quite meeting the standard, which for many in that situation could be incredibly discouraging. A more helpful term to describe the gray area between healthy eating and a full-blown eating disorder might be disordered eating. But overall, our concluding thoughts are that we gleaned much from the book that we will be able to use in our future work with clients who may find themselves relating to food and their bodies in unhealthy ways. We would also recommend this resource to family members and loved ones who are affected with almost anorexia. Thank you.